It's all now about reinforcing the message, the physical distancing, the frequent hand washing, wearing a face mask. That's a challenge for public health units across the province right now as Ontario loosens more restrictions so more people can get together now. I think it's up to 10 people from 5. Restaurants now serving people in an outdoor patio. Our range of travel is now expanded as well. Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District Health Unit. She's on the line. Dr. DeMille, good morning.
Good morning, Lisa.
So how was the past week?
Well, the past week was, I guess, in many ways exciting. As you've already indicated, the province did announce that our area would be one of the ones that would be reopening, and certainly, and that started this past Friday. So we certainly got a lot of phone calls about people and organization businesses basically looking to reopen and looking, of course, to put all of the appropriate measures in place so that they can do so safely. So, I think this was a bit of a milestone for us to after being closed down for the past 2 to 3 months. It was nice to sort of know that we've gone in the right direction and that we've done well enough that we could actually be reopening and be looking at that.
Mm-hmm. And we did have some more positive tests, right?
Yeah. So the weekend before, we basically had two, one on Saturday, one on Sunday, and then on Friday we announced 2, one in our area in Thunder Bay here, and another one in another area. So so we do have. I mean, there's a lot of testing happening. It's actually a tremendous amount of testing that's actually happening, and so we are picking up some, and I'm not really, in some ways, not surprised. I do think we will continue to see some sporadic cases, and if these individuals are infectious, we may see some spread within a particular group, hopefully sort of a small group associated with that person, and of course we're going to be following up very aggressively on any positive result, but it's a little bit, uncertain about how this is all going to play out as we start to reopen and start to gather more. And that at the same time, I have to say, I live in Thunder Bay. I go places here, and I'm very pleased overall at the measures that people have put in place. When I go to the grocery store, or and it's. So it's finding that right balance, right, of being able for us to do more with the measures in place, but recognizing at the same time that the more interactions we have with one another and in groups, the more the virus could spread, and so we know it's still here. But if we do this right, then we'll keep it at a very low level. Mm-hmm.
Mm-hmm. Now, what about traveling in northwestern Ontario right now? Like, I'm just thinking from Toronto to Thunder Bay to Winnipeg. I mean, where's our field of travel now?
Yeah, so I'm pleased, actually. I follow what happens in the rest of Canada, and particularly sort of Toronto and, where people might like to travel from here, and very pleased that all over Canada, we seem to be recovering from the first wave. So the province, of Quebec, the Montreal area was certainly one of the hardest hit. And in Ontario, there was areas down south, southern Ontario, particularly the GTA, that had more cases and had some ongoing spread. But it really appears that that's going very much in the right direction right now. Looking to the west, Manitoba did overall very well. So, when we think of the summer and people wanting to travel and, potentially, we've relaxed some of our travel recommendations. We originally, for a while, we had recommended if somebody was coming into northwestern Ontario that they should self-isolate for 14 days. We've dropped that, just recognizing that people, everywhere is doing well. So and people do want to travel, and it does limit people considerably when they have to self-isolate. Similarly to people from this area who maybe want to go somewhere else, and when they come back, whether they, this is about the general public, whether there's not necessarily a need per se to self-isolate. However, I think people need to realize that there's virus. Is still going to be with us throughout the course of the summer, and there's maybe clusters or outbreaks, and these might be more likely to happen in crowded places. People need to realize if they go somewhere and they come back, they could be bringing the virus back with them. And this is, people don't know they bring the virus back. You kind of find out later, so we really are asking people to be mindful when they travel, where they're going. Consider, what might be happening in that other area. Are they going to be in crowded places, to take all the appropriate measures to keep themselves and others safe. And then when they come back here to really mindful of monitoring themselves for symptoms and getting tested or isolating immediately if they have any symptoms, but then getting tested to see if it's actually COVID. We can continue to contain the virus. That's what we do when we have an individual test positive. We immediately start working with them and supporting them and isolating, but also tracking down anybody who might have been in contact. And that's really about containment, and that's what we plan to do for any other cases that we get. And so certainly asking people who are traveling, but even people who are around here to just be mindful if they have symptoms, isolate, give us a call. We can arrange for testing and certainly supporting them if that test turns out to be positive.
Now, we had somebody ask about people who live in assisted living or community living. Are they being tested?
Yeah, well, that's a very good question. And what's happening is the provincial testing strategy was launched a couple of weeks ago, and now it's being implemented. And there is sort of this broad-based testing of kind of large groups of people, and we see that in long-term care. So right now, long-term care staff are being tested at least twice in the month of June. And then there's testing moving forward in retirement homes and other settings of higher risk, and congregate settings are part of that sort of, the various different types of supportive living in congregate settings. We also know, like, for example, at corrections, there was some testing done there as well. So this is unrolling. I don't have... it's Ontario Health that's sort of leading this sort of testing initiative and trying to coordinate it so that the tests are getting done in a reasonable way and not causing a backlog. So I don't exactly know when the congregate setting is moving forward, but I do know that they're on the list.
Yeah. Wow, so much has changed in a week. I hope things continue to be on this slow basis, Dr. DeMille.
So do I, Lisa. Well, you know what? It's in all our hands. Everybody who's listening, families and businesses and organizations, it's all about taking all of those measures as individuals or as workplaces and businesses that really help keep ourselves safe, help keep everybody else safe. And you know what? We've done it. We did it in the first wave. We can continue to do it and prevent really COVID from getting a hold here.
Thank you so much for joining us again.
Lisa.
Really appreciate it.
No problem.
Dr. Janet DeMille is the medical officer of health for Thunder Bay District Health Unit. Bay District Health.